Hi, I'm Kirsten McLaughlin, Public Affairs Manager for Cox Communications. Welcome to Community Connection. Here with me today, I have two representatives from the William Sansum Diabetes Center. We have Pam Mickelson and Mary Keneally. Welcome to you both.
Thank you. Thank you for having us.
Thank you for having us.
Thank you for being here. So let's start with you just telling me a little bit about the William Sansum Diabetes Center.
Well, probably our biggest news is we have a new name. And so with new name, new logo. The reason that we decided to go with a new name is, number one, we wanted to honor our founder, Dr. William Sansum. A lot of people don't know that Dr. Sansum kind of created history back in 1922 in May, where he was the first U.S. doctor to inject a patient with type 1 diabetes with insulin. Back then, if you had type 1 diabetes, it was a death sentence. Charles Cowan was probably slated to die. He ended up living to be the age of 90. He outlived Dr. Sansum, in fact. So part of it was to really honor and respect Dr. Sansum and his history. It was also to help us separate a little bit from Sansum Clinic, because so many people confuse the two institutes. And we also wanted to focus on being a diabetes center. Our old name said we were a research institute, and while we do extensive amounts of research, we also do education and care. And so it was very important for us to kind of bring back the focus into that we do more than just one thing, that we do research, education, and care.
Right, so I know the center has been around, you're celebrating your 70th anniversary.
Our 70th anniversary.
So tell us more about the services and programs that you provide to the community.
Well, as I mentioned, we do all kinds of different research. A lot of it is for type 1 diabetes. We do diabetes and pregnancy research. We do all kinds of educational outreach, both to Latinos and to English. We do nutrition classes. We do a wide variety, and Mary's going to be telling you more about those in a little bit. And then we do clinical care. We just recently hired a pediatric endocrinologist who's going to be starting a pediatric endocrinology practice, which is something that there's very few of them in the nation.
And how large of a community do you serve? You serve Santa Barbara, but how far beyond our local borders do you go?
What would you say?
Oh, I think we go the Tri-County.
Yeah, I would say, I know we've got people who come up for support groups all the way from Ventura.
Oh, wow.
Yeah, we're really the only diabetes center in this neck of the woods between LA and San Francisco.
Wow. And so, as you know, each year in the fall we celebrate Hispanic Heritage Month. I know that diabetes care and education is especially important in the Latino community. Can you two speak to that and tell us what work you're doing in the Latino community locally?
Oh, I'm so glad that we are touching this point right now, because as you know, here in our community, there are so many Latins, and when they come from other places, their way of living changes, their way of activities changes. So when they are working here and they are raising their families, and many of them don't have enough money to support themselves, their health is the last thing that they are going to take care of. And so when they find out that they are pregnant, the ladies are pregnant, for example, they are diagnosed with gestational diabetes. They are referred to the county clinic, where we do education to them while they are during the 9 months of their pregnancy. They are taking care of themselves, and they are really following the diet and following all the instructions from the doctor and stuff. But after they deliver their babies, what happens? A year after, we are going to see them with type 2 diabetes. Where do they go? If they are not checked, they don't go to the doctor. But if they can attend our classes that we offer, which are Semillas de Cambio, and it's a 7-week course, and they attend those classes, then they continue on living the way they were taught at the beginning, modifying their way of eating, modifying their lifestyle, and so on and so forth. And so, but if not, if they don't have the education, then they become being diabetics, type 2 diabetics, and that's for life. And so what do? We partner with the neighborhood clinics, and we do Ocho Pasos, it's called, our education program, where we offer our services for free so that the Latin community can learn how to prevent diabetes. They can learn how to manage their diabetes. And it's an 8-week course, and it's free of charge for the community. And so that way they can learn how to manage their diabetes. At the same time, they can be people that are helping, in their families. They can help their community as well. And at the same time, in our center, we offer our classes every Thursday in Spanish at 4 o'clock. And it's free of charge for anybody that would like to attend. And we talk about diabetes, nutrition, and that's in Spanish. And the one that we have on Thursday as well at noontime, it's in English. So that is free of charge as well. So we do so much education to the community, and for the Latins especially, we want them to come and attend those classes.
So let's expand on that a little bit. Your Diabetes Now program that I think you were just touching on, tell me a little bit more about that, because that's a great way for folks to learn more about what you are doing and get sort of a real introduction to
basically that's what it
Center.
is. It's an introduction to the organization. It's we call it a tour of our mission. And it's an hour long. We ask you to come and stay for an hour with us. If you come, it's every second Tuesday at noon, comes with lunch for free, and then every fourth Thursday at 4 o'clock. And it's a great opportunity to come and learn more about what the organization is. We tell a story about somebody in research, somebody in education, and somebody in care. Sometimes we actually have a patient there telling their own story about how the organization has changed their life, which is always phenomenal and much more touching than me telling that story. And it's a great way to learn more about how you can help out, we have volunteer opportunities. We have, obviously, we survive on donations. We're a nonprofit organization, and so,
Tell us more about the volunteer opportunities. Some of our viewers may be interested in getting more involved.
Well, one of the things that Mary's programs do is that if you go through the programs, you can become a promotora. Do you want to talk a little bit about that?
Yeah, when I mentioned about the Semillas de Cambio, and it is a program for postpartum women. And as I mentioned, it's 7-week classes. So the people that are interested, women that are interested in becoming teachers or becoming promotoras, which are health workers. So they go through some training with us, and they are the ones that are giving those classes. They are the ones that are teaching peer to peer. They are teaching them how to live healthy.
Oh, that's great. And you offer all the training through the center?
Yes.
Yeah.
That's great.
And then we also have other volunteer opportunities where we need clerical help stuffing envelopes. We do episodic volunteers for events that we have going on. We have a big fundraiser every August called Taste of the Vine, and I have 50 volunteers just for that day alone.
Right. Anything else you guys would like to add? Any information you'd like our viewers to know about the center and all the great work you're doing?
Well, I think it's really important for people to understand that diabetes is really prevalent, that a lot of people, especially with type 2, it's asymptomatic, and so unless you're going to the doctor and you're finding you're getting an A1C test, you may not know that you even have it. It can be a silent disease. And we are one of the only organizations out there that's really kind of serving a lot of different needs in the community for the diabetics in the community. And I think it's important for you to check on your own health and understand, especially with type 2 diabetes, there's a lot you can do to prevent it and make sure it's mitigated.
Give me some of those examples.
Diet and exercise. two primary ones. Not that any of us want to hear that.
Somewhat simple, but oh so complicated.
Oh, yeah.
So as we wrap up today, we have some parting words from you, diet and exercise, knowing that this disease really can be asymptomatic, so people should be checking in with their doctors. And if they are diagnosed, they now know, our viewers now know the resources that are available at the clinic. So thank you so much.
Yes.
Thank you.
And as we finish up, any final thoughts?
We forgot to mention something, that we have a volunteer that offers his time to do cooking demonstrations, and that's in our classes as well, in English and in Spanish. And so we need volunteers, and just to let you know and to let everybody know that our center is where they should come if they have diabetes or if they have prediabetes.
Great. Thank you both for being here today. I truly appreciate it.
Well, thank you.
Thank you for having us.
And thank you. Until next time, this is Community Connection.